clients, and it keeps coming up in, are these long treatments? How long do I need to be treated? Let me turn it out on its head. Somebody with diabetes that you know, how long does a person need treatment? Somebody with high blood pressure needs treatment because you're actually supplying from outside what is not being produced inside.
Right.
There are two kinds of treatment for illnesses on this earth. One is like you do for fractures. There's a fracture, like you said, there's a cut. You put one bandage or you put one plaster around it, gets better, you're done for life. On the other hand, there are illnesses like diabetes, etc., where this is a long-term problem and it needs long-term help.
Yeah.
So we have, and I just faced a question just before coming here from a client who said, but I don't want to continue taking medication into my 30s. I understand. However, if what is happening is going to continue into the 30s, you better be protected against it.
Right. Yeah, if other things can help you get out of it, then that's great. Then you can stop.
So in the field of mental health, somehow we tend to apply different parameters than we apply to the rest of our body.
Yeah.
Actually, I have one question. You've both been practicing with this for such a long time and studied also. How many patients that you have seen, and I'm not looking for numbers, but then have you had the experience of somebody recognizing this in themselves and coming and telling you that, okay, this is what I'm feeling, or it is seen by somebody around them and they push them into this or bring them into this? Is there somebody, a portion of people who have recognized these, like I'm feeling low or I'm feeling anxiety, and they have come to you accessing for help?
Okay, Himani, you give the part, I'll give the part of the older physician.
So that's actually what we call insight, whether someone recognizes that there is a problem and that, this is where it's coming from and, I need help for it. So especially with the common mental disorders, large percentage of people who come in do have insight, do recognize that there is a difficulty. People who don't recognize that it's a difficulty are more often, especially with OCD, with addictions, with the severe mental disorders like bipolar disorder or schizophrenia, there people are less likely to recognize that they have it. But also in terms of treatment itself, I think when they first come in, just to be told that it looks like these are your problems, this is where it's coming from, I often see a huge of relief with clients, because for the first time, like Dr. Vivek was saying, there's a name to it. That, okay, so this is a real thing, that it's not because there's something inherently wrong with me, which nobody else has. Just to say, this happens to a lot of people, and this is what it's called. These are the possible causes, etc. That is a huge part of the treatment.
Right.
And most people do tend to feel better, especially the symptomatic relief, feeling better in terms of their mood, in terms of their managing anxiety, that sort of thing, tends to happen with approximately about 10-ish sessions of psychotherapy. But when we're talking about things like self-esteem, that's obviously a longer journey. So like Dr. Vivek was saying, about 30s, if this has been the way you function for about 30 years of your life, it's not going to get better in 1 week.
Yeah.
Right? So it's not like a superficial.
True.
Definitely.
Definitely it requires consistent, interaction.
But let me add one S to your I. She was talking about insight. There's something else called stigma, shame, and that is a major, what shall I say, deterrent to people seeking treatment. Apart from lack of knowledge.
Yeah.
As an older physician, let me say that the internet has been a great move. More and more people are actually walking in saying that, Doc, I might have this. Will you help me? And actually, more and more people are, if you take a longitudinal view, stigma is still not gone. Stigma is still a major part of our life. Most people want to hide these things, don't want to talk about it in their family. But there is a change happening. There is a smell of dynamite in the air.
Great. So let's move on. I think we've spoken a fair bit about these two important what we call as the common mental issues. I would like to move on to addictions, which is the other big thing. Maybe we can go to.
Have a couple of questions on the women.
Yeah, we'll do that. We'll come to that as well. Let's go to addictions at this point. Can we see this one? So this is a work from PV as well. Again, a series of photographs, but it has got something common in all of these photographs. What does that mean?
These are selfies. Okay, so I'll put it that way. So I shot myself.
Okay.
Pictures, self-portraits. As photographers, we always call it as you set up the camera and go and shoot. But suddenly, at some point in time, I get to read about self-esteem and it becomes a mental disorder for people to show them in the beauty and the best of the best angles, best of the best situations, best of the best backgrounds. So I thought, let me portray how people struggle, how people take risk, how people wanted to show their own things, the best of the best. Because sometimes they die, sometimes I see
Taking selfies, yeah, people falling off cliffs.
Yeah, different things. There are people who go to the other side. They take selfies in front of accidents. They take selfies in front of dead bodies. What kind of mental?
They take selfies in front of people who had an accident. Don't give help.
That's what
Give
they
help.
take selfies. So I was trying to understand what goes through their mind in terms of, to leave it to the audience to think through and then think why what is happening. So I shot in this monuments, all these interesting places in Bangalore.
Yeah.
There's a Dhobi Ghat, there's a Dept tower, there's a temple, there's a cemetery, you can see a metro station, there's all those places.
Right.
So that becomes too much of an addiction. How they have to look beautiful, this particular angle, when they put it, the kind of expression goes through, and putting it live into Instagram or the social media.
Yeah. Immediately it has to be seen by everybody, right? You have interesting lights from various sources. I like the guy with the staring at the headlights of the oncoming vehicle taking the selfie.
What is worrisome, I would say, is the extent people go to get these imagery.
Yeah.
Whether it is standing in front of a crocodile and taking or going climbing the cliff and almost to the
It has to be
unique.
So, and we've also realized that a lot of people, a certain big number of people have died taking just the perfect selfie and whatever has been dictating their mind to do. So this is one of the things we try to do, like standing near the traffic and achieving that.
So is this becoming an addiction, or is it already?
There was another painting.
Yeah. Yes, that's going to come up. That will come up next.
Shall we take that?
You want to take that as well?
Because I think
Okay.
the two need to be read together.
Okay. Get the next one. Not that one, not that one. This one. Right. So the Sharmila, what is this?
Yeah, this is actually called a linoleum print. Linoleum sheet I have cut through and carved out and then taken a double colored print on paper. So that is the medium. And the thought behind this is there is a kind of a comfort zone in all of us that we get used to, whether it is pain or whether it is some kind of an addiction or anything that we get used to. It's a perception in ourselves that, okay, this is what it is and this is what we want to be. Here, the man is inside a prison cell kind of a thing, and both the doors are open. He knows how to get out of it. But that small bit of thing that is there in front of him that is actually deterring him from getting out, he's happy being there. He's happy behind those bars. He's not even seeing those open doors. So it was my perception of thinking that somebody addicted to or somebody in a space where they find themselves, okay, this is it. I don't want to go anywhere else. Though I know that could be for the better or for the worse, I don't know, but I don't even want to try it. I'm happy here, I'll be here, remain here. The status quo that happens. And the lack of drive to make one's life better, maybe or taking those chances, taking those open doors and trying to peek out of that and see what holds. They're just there.
Was it
and
inspired by
do the same
something
thing.
that you, was it inspired by something that you know or saw, or was it more?
Yeah, I
Awesome.
did. It was inspired by a closer relative who went through an addiction with alcohol, and how it was like a self-absorbing thing, because he could not see beyond the fact that he just wanted to have it. And
Yeah.
no matter how much, how educated.
You always
how
wonder
he
about
was,
that,
always
right?
wondered why. I mean, in spite of being told never to do it.
I have an experience about this. One of my relatives, she was into alcohol and smoking. I don't know what all. But then I told her, why don't you come out of it? There are ways and to come out. And one of my friends, she was previously into addiction and she went through rigorous, not rigorous, and it was like some very cheap, it's not even expense, about expense. There is a group, they will help you to come out of it. Like, whenever you feel like having a cigarette or something, just call them up. They will just, it's like a therapy.
Yeah.
And she came out very successfully, and past 3 years, she's not doing that. And I told this to my cousin, why don't you try this? And she said, okay, I'll tell you. But it's not happening. So this painting is extremely relevant to
Yeah,
that.
and here the
She can
boy
go
is
out,
also turning towards himself.
but something is pulling her towards that side.
They're not looking
comfort
for
zone.
answers.
So
That's
what's addiction?
Yeah, so before we go to addiction, I mean, I would love to actually, tackle two things, based on these two.
Okay.
One is, of course, you talked of selfies. Okay. So selfies, are they an addiction? You asked, is it an addiction? As of now, it's not. In 1984, sometimes somebody published a paper that the American Psychological Association had declared this to be an addiction called selfitis. And there was a lot of writing at that time, and it turned out to be a hoax. But sometimes hoaxes turn into
reality.
And then,
like science fiction.
yeah, many
it's
years ago in the 80s, there was one person who actually talked about internet addiction, internet use disorders. And it was a hoax. But it later turned out, and people went in and actually looked at it, and the World Health Organization and the American Psychiatric Association have actually recognized it to be one of the addictive disorders. Now, this is interesting because when we talk of addiction, all you guys talked of addiction related to substances, alcohol, drugs, etc. But addiction can also happen to behaviors like gambling, like internet gaming, or taking selfies. Now, what is addiction? The core of addiction is actually loss of control. Anything that you lose control to is an addiction. And it is accompanied by other things. I mean, it's not just loss of control. There's also one word called salience. Salience is important. That becomes the most important thing. Nothing is as important. But that becomes the thing to do. Okay. Looking after your job, looking after your children, looking after your day-to-day responsibilities, that takes a lesser importance.
Right.
So taking of the drug and seeking the drug becomes the most important thing.
Well, I've seen that with people who give up families to go and be with babas and with other things as well.
Absolutely.
Completely.
So you can have addiction to some really lovely things. I mean, you can have addiction to exercise. Exercise is not bad. Googling and getting information is not bad. But you can get addicted to it. Talking on the cell phone to somebody else is a good thing, but you can get addicted to it. So it's not alcohol which is causing the problem. It's not tobacco. I mean, tobacco can cause a whole lot of problems. Alcohol can cause, but the addiction is that the brain gets used to this loss of control, right? And what happens is that because you use something regularly over and over and over and over and over again, your brain structure changes, your brain function changes. And it is a plastic change. It's not something elastic that it snaps back.
Right.
And therefore, it is long lasting. Therefore, the person in your picture can't come out. Even if something better is offered, what is happening is the only sure thing in life. And you stick to that. And the fear of having withdrawals and having shakes or something when you stop using, the fear of what you're going to do. Today, the lady that I was talking about, she said, you know, the reason I can't give up smoking. I said, what? What am I going to do?
Yeah.
You know, I'll get bored. You know, what am I going to do? And that's such a silly reason. That's such a silly reason.
Is it the action that you're addicted to, or is it the nicotine, or what is it that you're actually addicted to, right?
Yeah. So the people.
After a while, you forget that. I think.
So people have gone here, there, everywhere. So there are lots of theories. But ultimately, what happens is that activity.
Yeah.
You know, one of the reasons why we are addicted to certain things. We don't get addicted to. I'm sure we can get addicted to drinking water also. But anyway. But
now we have reminders.
Yeah. But most of the things which cause addiction do one thing very well, and that is they raise activity in what is called the reward circuit of the brain.
Yeah.
The reward circuit of the brain is a very, very old part of the brain whose job it is to ensure that we do the things which are necessary for survival. Sex. It has to be rewarding, otherwise you're not going to do it.
Yeah.
If you don't do it, there goes the species.
Yeah.
Food. You have to eat, otherwise you're going to die, your species goes. And so evolution has created this reward circuit to ensure that you do these things. Human beings and some animals have found that you can actually fiddle with the circuit by using certain things which increase activity here and give you that high. Also, for some people, it gives you what we talk is executive control. We talked about it a little while earlier. It actually increases that initially. So for some people who are at higher risk, who don't have that executive control, indulging in drugs, alcohol, or even cell phones, etc., initially gives you that sense of control. So you tend to do that over and over again. And especially if you're younger and your brains are less protected, your wiring is less insulated, then this change becomes much more prominent and long-lasting.
Okay.
So these become long-lasting patterns.
Is there a gender bias to this, to addiction? Is males, are they more prone than females, for example, for being addicted to different things?
That better, but I think there are differences in what kind of things people get addicted to and how it shows up.
Yeah, so I mean, when you look at things like alcohol, etc., there is a predominant male predominance, but then partly it's biology, but also partly it's gender. It's much easier for a man in society, especially Indian society, to go have a drink. Drinking among women is frowned upon. But then if you look at, for example, cell phone, shopping and things like that, the ratio suddenly gets a little more equitable, but males are at much greater risk because males are at much greater risk for the vulnerability that I talked about. And I keep, wherever I go these days, I try to turn the dialogue to this vulnerability, because this is something that we are recognizing, that there are some people who are at much higher risk.
Right.
And if pediatricians, if school teachers, if parents were able to recognize this and put in interventions early on in life, a lot of this can perhaps be prevented.
So today, if you look at cell phone, which has become so addictive for all of us, irrespective of the age group, the people who come up with programs, with apps, they are going basis the mindset that will create that addiction. So you are actually having a whole host of things being thrust, knowing fully well that this is going to be an addiction that's going to catch on with the people. So sitting on the other side, what do we do? I mean, it's not our fault.
It's not only the cell phone or the apps. Don't you think even the cigarette packs that carry this thing, it is injurious to health, but still there isn't given.
No, that is
Hello, let us bring perspective. The first people who found out how to get, attract somebody's vision were the artists.
Yeah.
So let's put where, give the devil its due. You're the guys who started. When Leonardo da Vinci paints the Mona Lisa with, that whatever sfumato technique, and your eyes go to it, You are trying to train people to look at it and look at it and look at it.
What you
and look
want
at it.
them to learn, yes.
And the entire advertising, it does.
It does
well.
come, yeah.
Exactly.
And now there is
Psychology.
neurocinema. You've heard of neurocinema, no? So they take you and they show you the film, and then they put people and they put electrodes onto their head and see which parts of the film you are reacting to the most.
Yeah.
So cut the other bits out.
Yeah. Yeah.
So even things like Netflix, for instance, it's,
Yeah.
it goes straight on to the next episode, like
Yes.
within a second or two. So, it really is beating your will to
Not only that,
Stop, yeah.
I feel that it also suggests,
Yes,
depending on what you
yes,
know,
yeah,
it
that's all
suggests which are the
artificial
other things you
intelligence,
might enjoy.
all of those things, yeah.
No, all these things are
So
funny.
we're going
you
to
are giving
continue to
me,
be going to be faced with a barrage of these things. Our children are going to be faced with this. We're going to be faced with this. And this is
so
something where.
That's where what Dr. Vivek was saying comes really into play, because things like innate vulnerability. So having reasonably good self-esteem, having other things that people can resort to. So for instance, the American Head Start program was actually dependent a lot on giving children in extremely vulnerable settings, high crime, high drug sort of areas, giving them an opportunity to develop certain resilience, certain things that they're good at, etc. So for instance, having maybe good self-esteem, having better executive control, having better ability to regulate emotions. So every time I'm upset, I don't have to reach out for a drink or something.
Right.
So that's possibly, those are
Yeah,
things
but
that are
I've seen
connected.
this. I've seen colleagues who perfectly function through the day. 5 o'clock, arms tremble, the hands tremble. And 5:10, you're upstairs, you're arranging things, you have to have the drink. So it's like, it's just that one line. And up till then, you're proceeding as if you're absolutely fine. And after that, your brain just cannot resist it. It has to be done.
Yeah, so the first time anybody realized this, I don't know whether it's a nice story. I'm telling you the story. The first time people realized that there was something called a reward circuit was when some people implanted an electrode in a rat's brain.
Mm-hmm.
And then the rat pressed a lever and the electrode went buzz on that circuit.
Stimulate
and it stimulated that. And then the rat learned that it could stimulate itself, and it kept on stimulating itself so that it didn't eat, drink, do nothing, and just died stimulating itself.
Yeah.
Okay, so brains can be very, very predictable and reliable depending on their programming.
Yeah.
as much as they are unpredictable.
As much as they are unpredictable.
So, so therapies. So, how do we address this? What do we learned medically about this?
Okay.
And are there interventions?
So there are interventions. There have been interventions for a long time.
Yeah.
It's about how good the interventions are and how one must realize to begin with that when changes like addiction happen in the brain, or for that matter, changes with most psychiatric disorders, these are long-lasting changes. Which is why we call it neuroplastic. When you have a plastic deformation, it remains deformed. You have to put heat again to reform it again. So how do you change it? As would have been evident from now, there are two things that happen. One is the vulnerability. From childhood, you have the vulnerability, which takes you to the use of the substance or use of the behavior in the first place. And the second one is the adaptation, the neuro adaptation that has occurred. So you have to treat both. So the long-held practice of taking a person, putting in a rehab center and saying, stay there for 6 months and you will forget the practice is not a very efficient one. Some people might, it might work. For most people, it is not very efficient because this is hard-coded. So one really needs, again, a combination of medicines, learning different strategies, learning how to deal with, preventing relapse, because there are triggers which set you off. Like you said, 7 o'clock comes, there's a trigger, I go.
Yeah.
So one needs to dissociate trigger from the reaction. And these can be done by learning alternative behaviors. These can be done by that if you again lapse, which you will, you are picked up and taken into treatment. But things happen, people get better. And more people are getting better than they used to earlier. less and less people are dying because of drug-related problems in our own lifetime. So things are getting better. More people know that there are available treatments, the better it is. The earlier you come, the better it is. And this is general across the board.
Yes, and that the will to recover from that addiction has to be there.
Okay, let me put a spin on that.
Okay.
The very areas which are affected in the brain, which make you vulnerable, are the areas where human volition or human will is created.
Yes. That's what
So it's like telling a person who has 2 amputated limbs, saying that you must have the will to run the 100 meters and win the Olympics. So you really want him to do that? Give him prosthetics and those carbon legs.
So what you're saying, so this is like votes. So if somebody gets 51, the other has to be 49. So they have to give up, they have to give up something in order to, out of that bank of willpower that you're talking about?
No. I mean,
So if you
do you want to
draw-
explain?
No, so the other thing is also that there are ways, I think the understanding has to be that it is difficult to get over this, because
Yeah.
why would I give up something that's inherently pleasurable? That's,
Yeah, but even if you tell them, listen, you're gonna die
correct.
tomorrow.
But that is long term.
You're gonna die
That's more
tomorrow.
long
But
term than
that
right
should
now.
be
No,
something that
so obviously that doesn't
should be
help.
scary, right?
So
Correct.
obviously the 2 things that don't help, and
Yeah.
we've learned it over many years of making mistakes,
Yeah.
is scare tactics to prevent somebody from doing something. Please remember, the first time that you tell those Gandhi photographs of people with red blood coming out and skeletons, etc.,
Yeah.
are the best advertisement for alcohol and drugs I've ever seen in my life. Every time you go to a school and you tell the kids, you know what? If you drink, this is what is going to happen to you. If you smoke, as soon as you finish your lecture, the kids are going to say, okay, can I have a smoke? Never ever try and scare a person into to understanding. It doesn't work.
Yeah.
Okay. So like you put it so well that doesn't really work. What really works is, okay, let's see the other side of it. Let's see how you work with this, because what we do is called a motivational balance.
Yeah.
What are the good things about your using this substance? There are good things, otherwise I wouldn't do it. What are the not so good things about doing the substance? Okay. And if you're going to do it, what are the things you look forward to? Everybody has a dream. However miserable they might be, when are you going to reach your goal with this current behavior? And it's only when they are able to handle this ambivalence that they are able to change. We are all of us caught in a state of ambivalence.
Yeah.
2 steps
We
forward,
actually pick
1
up
step back.
on the conflict and kind of
Yeah.
heighten that.
And
Okay.
only when that conflict is heightened and my reasons for changing become more important than my reasons for not changing, will change occur.
Yeah, but it's
And that's what she does.
Strange.
And that's what she does very
it's
well.
really strange because with
So-
my father was a smoker, and he smoked right till his last days. But he was very healthy; it didn't really affect him. And my mother was always anti, right? And he knew. And after a while, towards the later parts, it almost became a joke for him. Mom says no, but I can't. He knows he has to. Very intelligent. All these people, many of them, very, very intelligent people, very driven people, many of them, but they just can't rationalize it. So if you're saying, what about your future? What about your, the family? Aren't you going to enjoy your grandchildren? Why not stay back and see your grandson getting married? It's all good, but it's not
But sometimes 100 doesn't work 100% of the time.
Yeah.
It works 99.9% of the time.
Okay.
But
Yeah,
having
that
said
was
that,
it.
remember your dad came from a totally different generation.
Yeah.
Doctors those days used to prescribe cigarettes.
Yeah.
They used to prescribe cocaine drops also
Yeah.
for children. But that's a different issue altogether. But look at it on a larger perspective. It has become much more difficult, much more undesirable to smoke out in public. Less and less people are actually smoking. There are too many who are smoking, but there's less every year. There is some movement that is happening. And so change can happen. Social change.
We're looking
does
for
happen.
marijuana now.
Well, that's a different, we should do a different discussion.
Different discussion.
But I think we have to recognize the fact that, like what Vivek was saying, that there are there are the pleasure centers,
Yeah.
the reward centers, the reward circuits in the brain. And there are the parts that process logically, clearly. Yes, I know all the facts
Right.
about smoking and drinking. But there's often a disconnect between the two. And therefore, the interventions try and help them make that connect, for one thing, and also possibly strengthen certain areas. So we've been talking quite a bit about executive control. That is something that is impaired in people with addiction. So can we try and heighten that? Can we try and build on that? Because that's also something that's affected because of the drinking and the smoking, or it can be a pre-existing one. But can we increase that? Can we increase their ability to manage stress, manage emotions, etc., etc.? And can we reduce the pleasure or the urge to take the substance, the drug?
So let me ask you the $1 million question. As parents, do we give them a glass of wine at 12 years?
Okay, number one, since you brought up the word,
I'll also
12.
add this question, please, then it will be better. I have a daughter who's 8 years. So we're trying to reduce as much screen time as possible apart from the class. We said at 3 o'clock is your mobile phone time. So sharp 3, she comes and waits. I want my phone. And then at the end of the whatever 3 to 3:30 or whatever, and then she always says, "No, I want this last 3 minutes extra, 4 minutes extra." What do we do with this kind of
She's
situation?
nodding away. She's got an 8-year-old. So you guys can talk over. Yeah.
So, two things. One is, let me pick up on the 8-year-old that you talked about. Number one, we do know the earlier you start, the greater the chances of you developing a problem. Okay. So if you start by the age of 16, your chances of developing an alcohol-related or a drug-related problem by the time you're 35 is around 85%.
Wow.
If you're able to delay it till the time till you're about 25 or 30, your chances of getting a problem come down to 5%, which is the risk in the population. So there is, number one is definitely try and delay first use.
So the thing to say, okay, I'm at 18, I'm going to give a glass of wine to my son or daughter, and we're going to drink together, so that they know that there is a proper way of doing this, a more controlled way of doing this. So how does that?
Again, there are two aspects. One is, yes, there have to be rules.
Yeah.
You would rather that your children learn the rules from you rather than from their peers who are not good at rules themselves.
Yeah.
They're also learning. And you don't want somebody who's on learner wheels to teach another person who's on learner wheels. That's number one. Number two is that is what is right, what is wrong, whether in the context of your family, whether alcohol use is part of natural things. Then you teach your child what to do. People, for example, one of the people in the world with the least amount of alcohol-related problems are the Jews. Because they teach their children 3 things. One is, you shall not drink alone. You shall not ever drink and become silly. And the third thing, I forget what, but these are the first 2.
Get into a good business.
Yeah, that's a different thing.
Here's a business.
Sir, one question.
So no, I haven't answered the
Yeah.
So again, do you want to take that? This thing about
So what do you do? What do you do with your 8-year-old?
Because I think about this 5 o'clock, start shivering.
No.
3 o'clock is the right time.
It changes the time. These are 2 different things altogether. This is an illness. Okay. This is an illness. You can develop an illness. Your child can develop an illness with your iPad as well. So that's a different argument. And that happens because of repeated exposure. That happens because of early exposure, etc. So if your child is using,
can we have that at 3 o'clock or keep changing timings?
it's good to have rules.
Okay.
It's good to have structure.
Okay.
Well, let me just put it that way.
Yeah, we were talking the other day about the marshmallow experiment, which is essentially what this researcher did with children, and he offered them the choice between, you can have 1 marshmallow, 1 candy now, or if you wait for 10 minutes, I'm going to go out of the room and come back. If you wait until then, I'll give you 2. And the kids who were better at waiting and getting 2, that is, the ability to delay, the ability to wait, and not become impulsive and snatch the first one. The ones who were able to wait were the kids that developed later on to have much better executive functions, much better relationships, much better, at school, at the workplace, etc.
Yes.
Irrespective
And
of IQ,
less mental illness.
less mental illness, irrespective of intelligence. So that was a huge thing. So the better kids are at inhibiting, at learning to wait, at following rules and that sort
Really?
of thing early in childhood, they have much better outcomes later.
We're trying to look at that now as well, even in the workplace, isn't it? The younger generation, they want the rewards much faster, it seems like, right? They want it much faster. And we seem like dinosaurs trying to say, telling my daughter, takes 20 years. And she's like, what? What is that? It is not. So I think the whole society is kind of also being driven today in that generation, and we don't probably see that as much because we are in our take your time type of thing. But that is a big issue, isn't it?
Yeah, and that since you brought it up, the gig culture.
Yeah.
Where everybody's doing a gig is on a small short.
Yeah.
I mean, I don't know what that's going to. I mean, that's their problem. They have to deal with it. But one worries as a parent. One worries.
Yeah, I do a gig for 3 months, and then I'm
Yeah.
off for 6 months doing other things, and then I'll come back and do a gig. So that.
No, but I have already started seeing young people coming in as a consequence of the gig culture.
Okay.
People having depression, anxiety that we started talking about. So yeah, I mean, these are important levels. They haven't been studied yet. They're too fresh.
Can we go to the next
So
one?
just
Doctor, I
one
have
more question about who are this population who are most vulnerable to develop addictions?
Okay, it's not just addictions.
Is there
Yeah.
any
There
pinpoint
is.
on that?
In fact, that's what we kept talking about as vulnerability.
Yeah.
3 things. Difficulties with executive control. Executive control basically is difficulties with impulsivity. They can't sit in place, they're fidgeting, can't stand in line, can't wait for their gratification, etc. Difficulty in sustaining motivation. They start off things, halfway through they lose interest. They get bored, lower threshold for boredom. They're bored all the time. Difficulty in controlling their, or rather procrastination. Lots of, and that's a problem that a lot of people talk about. Then the second issue is this emotional control, difficulty in emotional control. And one part of that emotional control is what we call rejection sensitivity. That you feel that you've been rejected and you either become very sad, depressed, cut your wrist, or you do the opposite, which you get angry, break the TV, throw things, etc. And the third thing is what we talked about, emotional recognition. Inability to recognize another person's emotions or another person's feelings and mind state. And these are things which seem to predispose or precede a whole lot of the psychiatric illnesses that occur. In fact, the best evidence comes from this series in New Zealand, where people have been following up children from the time they were born to the time they were 48. So 48 years they followed up. And they find that the people who went on to develop psychiatric illnesses had these minor problems from childhood.
So can't we track them?
Yes, we can. Yes, we can. Yes, we can. This is why we are having these conversations.
Preventive action at that
Absolutely.
point.
Absolutely.
So are there